Coming up on the Get Lean, Eat Clean podcast.
We teach them about processed foods, and I tell people to try to eat foods with one ingredient, and that to not really worry about fat as long as it's, natural, real fat, not fried foods and stuff like that. But and talk to them about increasing their protein intake and limiting carbohydrates. Especially, we check insulin levels a lot, which is a good indicator of metabolic health and can be a warning sign far before you see an elevation in blood glucose or an A1C, which is a 3-month average of blood sugar. And so we look at that.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed the owner of Vibrant Life Direct Care and podcast host, Dr. Greg Dennis. We discussed what's wrong with our current sick care system, the importance of spending time with patients, testosterone replacement therapy, and what are the best markers to get tested when starting with a patient. We also discussed how hopefully more physicians will start embracing the importance of nutrition and finding the root cause of disease as opposed to just treating the symptoms. This was a great interview with Dr. Greg Dennis, a lot of great info that you could take to your primary care physician, and I know you'll enjoy this one. Thanks so much for listening. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Greg Dennis of Vibrant Life Direct Care. Welcome to the show.
Thanks for having me.
Yeah, thanks for coming on. I was on your we recorded on your podcast a few weeks ago, and decided it'd be fun to bring you on my podcast. A practicing physician out of Oklahoma.
Yes, sir.
Mm-hmm. Nice. And you practice with your wife. How many years have you been working together for?
Well, we both graduated residency in 2007. We were both in corporate medicine, although she was part-time, I was full-time. And so we were at the same place, but it was just been in the last couple of years that we have our own clinic and now run that together. So
nice. And part of the reason I wanted to interview you was because I would say you're a little bit out of the box in the sense that you're not like a general, I guess the norm physician that you would see. You focus on anti-aging, you focus on more like functional medicine and getting out of this sort of sick care model where we just give prescription drugs per people for certain things. Perhaps tell the audience how you sort of got into that. And was that right away, or is that something that you decided to do as you started practicing?
No, it came later. I've always been into wellness myself, but never really practiced that way as a physician because that's just not how we're taught. I mean, you go to medical school, you go to residency, and you're taught a certain way to think, certain way to practice. And I never really questioned that. I always looked up to our faculty members and the professors, that you think, gosh, they're the smartest people on the planet. And so you never question them. And so I practiced what I would call, quote, conventional medicine for many, many years. And I did, what people call evidence-based medicine. And like most doctors, when patients would question me, I would say, well, I practice, quote, evidence-based medicine. So you can't question evidence-based medicine, even though they're not getting better, and now I know, they should question their doctors. But at the time, again, I was thinking like most doctors and would say I practice, evidence-based medicine. And so it really wasn't until several years ago, I don't know, 3 or 4 years ago, and I just kind of had this epiphany. And I don't really know how or why, but I just got to thinking one day, you know what, my patients aren't really getting any better. I'm doing everything I'm supposed to do, but they're not getting better. They look better on paper. So for instance, if they have high cholesterol, I give them a cholesterol medicine, their cholesterol goes down. If they're a diabetic, I'm giving them all these diabetes medications that's recommended by the ADA. So their A1C, their blood sugar is better. So on paper, they're better. And so I'm doing everything I'm supposed to do, but they're still sick. They're still fat. They have arthritis. They have autoimmune disease. They're still dying of heart disease, strokes. Their health span isn't improving, nor is their lifespan. And so I just thought one day, what am I doing here? Like, what are we doing? There's got to be a better way. And so I just kind of went on this deep dive, this, kind of my own journey of looking at things like how can we get people better? And it certainly wasn't an overnight journey. I mean, I learned it. I'm still learning. But what I discovered is there are many things that they teach us in medical school and residency that are influenced by big pharma. And we can talk about this a little bit more later if you want, but of big pharma's influence in all these governing organizations that kind of govern what we do, the American Diabetes Association, American Heart Association, the FDA. And it really comes down to, it's all about money. It's not really making people better. And so anyways, I discovered the power of nutrition, and I had to really just learn on my own about nutrition because they don't really teach us that in medical school. And so what I discovered was you can reverse many diseases with just nutrition alone and lifestyle changes through fasting and exercise. And that all these medications that we're giving, many times, we're making the matter worse. And so through that journey over the last several years, I have become certified in anti-aging medicine, or the certification is called age management medicine. And so I just continue to learn in that and really try to go deeper into people's problems and discover the root cause rather than just kind of throwing medications out.
And since you decided to make that change, what else changed in your practice? Like, did you dedicate more time with your patients, and did you start seeing like more impactful results because of that?
Yeah. So without a doubt, when I kind of discovered all this, when I went on this journey, I was still in corporate medicine at the time. So in corporate medicine, I'm seeing 20 to 25 patients a day. By the time they get to me, I have 5 minutes to spend with them. And as I was discovering how I could heal people many times with nutrition, I mean, that takes more than 5 minutes to teach them that. And so I eventually got to the point where I was no longer a fit in corporate medicine. And so my wife already opened called direct primary care. And basically what direct primary care is, it's a model of care where we don't take insurance, and people pay a monthly membership fee, almost like a gym membership. And with that, they get just access to us all the time. We have a lot smaller of a practice. And so what we tell people is we have a small practice that we can take really good care of those people rather than a huge practice that, is hard to get in and you spend 5 minutes with them. And so, so I made that transition over to this style of practice. And so now I have the time to spend with people and can really, again, get into that root cause and walk them through this journey. And really, I've seen a ton of results since I've been doing that. And it just keeps fueling me to what I do, and that I have done the right thing by reversing diabetes, type 2, that is. Type 1 is a different animal, but, they never told me that you can actually reverse type 2 diabetes.
Right.
And so just doing that many times, improving and sometimes even completely reversing autoimmune disease and seeing people, lose a lot of weight and get off medications. I mean, it's been very rewarding.
Yeah. And so now you went to more of a monthly subscription model where you got cut out for a second. So I just want to recap.
Oh, I'm sorry.
That's okay. Where they pay on a monthly, it's not covered by insurance, correct?
Correct.
Will there be a time where insurance would maybe cover this or no?
Not our style of practice. And I don't know that we would want them to. because many doctors, and there's more and more getting into this style of practice, they're wanting to get out from the insurance companies, because many times the insurance companies, dictate what we can do.
Right.
And so they're wanting to get out from the insurance companies. So I don't think in this style of practice that we would really want insurance to have any part in it. What we tell people, kind of what the ideal scenario is, in my opinion, is people have a high deductible type plan. I mean, we don't want them to be without insurance. And so they have some type of catastrophic plan, if they have to be in the ICU or something like that. And then they pay us this nominal monthly fee, and we can take care of most everything. And in a preventative practice like what we have, then hopefully we're getting them well to where they won't need the doctor, and they're going to stay well. And of course, never ever use that catastrophic plan. But that's kind of the ideal scenario.
Yeah, no, that makes a ton of sense. And I would hope that this is sort of the future, right? That hopefully this is where we're going.
Yeah.
I don't know if that'll change as long as Big Pharma's in charge.
Yeah. It's slow. There again are more and more people kind of discovering, I guess the inadequacies of healthcare and some doctors, but it's slow.
Yeah. And what are some of the go-tos that you've been realizing that are working best for patients? Let's just say, I know your, low carb roll, or like what type of interventions are you using that, are sort of making the biggest impact with your patients?
Yeah. So we do a lot of education about nutrition. And we try to get people to understand that the, traditional food guide pyramid and this idea that, you need to eat low fat, high carb is not good. And that's really what's gotten us into this mess to begin with. Mm-hmm. I remind patients all the time that if all this would have worked, what they've been promoting all these years, we should have seen a decrease in healthcare conditions. But instead, we're seeing more cardiovascular disease than ever, more autoimmune disease than ever, more cancer than ever, more obesity than ever. I mean, you're in the Midwest as I am, and I mean the obesity. I mean, more people are obese than not, or at least around here in my state. Yeah. And so, I tell patients, if you want to just keep doing that and keep being on medications, which people think are the norm, then just keep following those recommendations. But if you want to be different than everybody, which unfortunately different is being healthy, then, we teach them about processed foods. And I tell people to try to eat foods with one ingredient, and that to not really worry about fat as long as it's, natural, real fat, not fried foods and stuff like that. But, and talk to them about increasing their protein intake and limiting carbohydrates. Especially we check insulin levels a lot, which is a good indicator of metabolic health and can be a warning sign far before you see an elevation in blood glucose or an A1C, which is a 3-month average of blood sugar. And so we look at that, and I talk to them about foods that can raise insulin levels, which is mostly the sugars and the processed sugars, and even fructose in many cases. And so we just kind of walk them through that. And then I introduce intermittent fasting to them, and that, maybe going times without eating is a good thing, and how to do that. And we talk about exercise and the importance of that. And we talk about, hormone optimization, which I know you're probably going to ask about. So yeah, those are all the things that we kind of focus on.
Yeah. What would you say? I know you said a few of them right there: fasting, insulin. You mentioned hormones. What type of markers do you, maybe if you have a new patient right off the bat, do you recommend getting tested?
Yep. So kind of standard stuff that I use or that I check is a lipid panel. Although I don't look at that the way that most doctors look at that. Most doctors look at a lipid panel and they look at the overall cholesterol and the LDL, which is the so-called bad cholesterol. What I look at in a lipid panel is more of the triglycerides and the HDL, specifically that ratio. And what that tells me, along with the fasting insulin level, is that's a marker for metabolic health. So most of the time, what I'm seeing in new patients is they have really high triglycerides, they have a low HDL, and then they have high insulin levels. And all that points to, again, poor metabolic health, which is really, it sets them up for, all kinds of chronic illnesses. And so again, we talk about how to reverse that. And if they are metabolically healthy, and I have this conversation a lot, then really the cholesterol doesn't mean anything, even the LDL, again, the full bad cholesterol, if they are metabolically healthy. And so that's been a big misconception among people, and even doctors, I think, have been kind of deceived, when it comes to cholesterol. But anyway, so I check that. We check blood sugar. I mentioned fasting insulin. I check hormone levels. I check thyroid levels, especially in women. It's more rare in men, but middle-aged women and above, I check thyroid. And then I check a vitamin D level on everyone. To me, it's one of the most checked things that there is. Is that a word, underchecked?
It is right now.
Yeah. Okay.
Yeah.
And
like underutilized, right?
Underutilized. Thank you. Yes, I couldn't get the word out. But its role in just general overall health in the immune system, especially as it relates to COVID, vitamin D is huge, and almost everybody I see, unless they're already taking supplementation, is vitamin D deficient, and even most of those people who are taking supplementation, they're not taking enough. And most doctors who it's rare that they check that, but the ones that are, and then recommending supplementation, they're way underdosing, in my opinion. And so, and then I check hormone levels, testosterone in men, and testosterone in women as well. And then all the female hormones, estrogen and other things. So that's kind of the standard stuff that I check. And of course that can change depending on what kind of medical problems they have. If they have a history of autoimmune disease and that kind of stuff, then, we'll add some other stuff.
Yeah. And I noticed as well, you mentioned autoimmune disease. I feel like that's thrown around so much. I mean, there's probably 80 types of autoimmune disease that are out there, some more common than others. Is there a certain protocol that you do as far as like diet that you've seen reversal in some autoimmune disease?
We don't have one protocol. I think it starts, as I was alluding to a minute ago, it starts with educating the patient that first they have to buy into the fact that they might get a symptom, at least symptom resolution, but possible reversal disease with their diet. And sometimes that's just a hard concept because many times they've seen a rheumatologist, and they're on these medications that are suppressing their immune system, and the rheumatologist has never mentioned anything about nutrition. And so many times that's just a foreign thought to them. And so just getting them to understand that, number one. And then number two, we just try to cut out the inflammatory things first. So the sugars, the processed foods, the vegetable oils. And so that's a good starting point, and go from there. Again, we talk about some intermittent fasting to help with decrease inflammation. And then it depends on the person. Some people can just do those things and get a lot of symptom relief. And then some people have to, really just be a lot more restrictive in what they eat. I mean, I have some people who do a strictly carnivore diet. And it's actually very successful in treating autoimmune disease. I have one guy in particular who has psoriatic arthritis, and he tried just a paleo diet, and he got better, but wasn't, completely symptom free. And so he ended up going strict carnivore. I mean, he's all in, like he eats liver, spleen, thymus gland. I mean, all the organ meats. I mean, not many people are going to do that, but that's all he eats. And anyway, since he's been doing that, he has zero symptoms of his symptoms, or of his disease. And so it depends on the person. And so there's not necessarily one protocol, but it starts with just educating them about limiting those things that are causing inflammation.
Yeah, that makes a lot of sense. And I've had clients get some great results on carnivore, and if they want to maybe down the road work back in some plant items, or some fruit and things like that. What else? Are there any other things other than nutrition that you focus on with your clients, as far as, let's just say, sleep or stress, or any like hormetic stressors? I know you mentioned fasting. Anything else?
Yeah, I mean, all that's important. Stress is a big deal, obviously, today. So,
right.
We talk about sleep, we talk about cortisol, and that's the nice thing about our clinic, because there's all these things to talk about that you're not going to resolve in one visit. And so when I was previously in corporate medicine, and again had 5 to 10 minutes with these people, you can't get to all those things. And so now at this style of practice, we can focus more on nutrition, and then they can come back and we can talk about fasting, and then they can come back and we can talk about sleep and stress and all those things. Hormones are another big one that we focus on. I'm a big believer in hormone optimization. And so many doctors will check. I'll just use men as an example. Our testosterone continues to decline from, even 25, definitely 50 years ago. We're seeing men with lower and lower testosterone levels. And so, conventional medicine's answer is they keep lowering the norm of what a quote normal testosterone level is. But as you get to your middle age, it's affecting a lot of guys. And so that's a big thing that we do, is to optimize, hormones. And I use the word optimization because most doctors will check and say you're low normal, but you have all the symptoms. But because you're quote normal, according to the lab, doctors will say, well, you're normal. You don't need any hormones. But I would view that, again, if they have symptoms, that I would say you may be quote in the normal range, but you're not optimal. So we optimize these guys. And now that kind of catapults them to make some of these other changes, because if I'm talking to them about nutrition and exercise and fasting, and their testosterone is in the toilet, which it probably is because of the lifestyle that they've been living, they don't have a lot of motivation because they have low testosterone, so they're fatigued. And so we get them started on testosterone, and then that kind of help to things. And then maybe later we can come off of it. Who knows? Maybe not. But so that's an important piece, and especially with postmenopausal women, I think hormone replacement therapy has got a bad rap just because of the WHI study years ago, which used synthetic, completely different style of hormones. We don't necessarily have to go down that rabbit hole, but by using bioidentical hormones that are safe, they not only can improve health span, but actually, and many times eliminate common illnesses that females have, like osteoporosis and things like that. So we focus a lot on kind of what we call hormone optimization. Yeah.
And with testosterone replacement therapy, this is something, if someone's low in testosterone, let's say they're 50 years old, do you start with diet and see if that'll affect diet, exercise, and then perhaps go to replacement therapy after that, or is it the other way around?
It depends. If they've got a whole lot of, say they're obese and, they're on a lot of medications, and then we may just start with lifestyle modification. What I find though, is that many times it's easier for them if and many people will think that that's maybe the easy way out. But in my clinical experience, I just find that it's better to maybe start them. And then that, again, kind of catapults them forward to make all these changes, because now they have energy, they have motivation to do it. And because it's going to take a long time to move that needle doing those lifestyle changes in hopes that maybe one day we can, wean off the testosterone. But I certainly don't mind starting them off and giving them that boost that many times they need.
Yeah, no, I totally see that, because it's sometimes in the beginning, it's all about getting small wins, getting results, and just building momentum. And like you said, it might take some time, just naturally, perhaps, to get that testosterone moving, where you could do it through replacement therapy. And like you said, get them positive, get them feeling good, and then perhaps down the road, wean them off.
Yeah. Well, what you have to be careful of, there's, testosterone is obviously, it's everywhere now. And you have all these men's clinics, or at least we do around here. And that's all they do is put somebody on testosterone. So if a 400-pound man comes in and he has all those symptoms, they're going to put him on testosterone and do nothing else.
Right.
And so I feel like you really need a practitioner that is going to look at the whole picture and not just put somebody on testosterone, but discuss their sleep and their stress and their diet and all that stuff. And so just testosterone is not the end all be all.
Yeah. And then what about for women? Do you see women low in hormones, like specifically even testosterone?
I do. So really the same way with men. We've seen a decline in men in testosterone, and we see the same thing in women. So even before menopause, we see a lot of women with low testosterone, and many people don't realize that women have testosterone. Now it's not the main hormone like it is in a man, but it is very important in women. Same thing. It gives them energy, gives them their sex drive. And so we see a lot of women, even we begin to see a lot kind of perimenopausal, meaning around the time of menopause, but that can start as early as early 40s or mid 40s. And we see a lot of women with lower testosterone. And so, we treat a ton of women with just testosterone replacement. And then once they hit menopause, then we just add that estrogen in. But yeah, it can be a game changer for women, like women who are low. And then once they get that replaced, they love it.
Yeah. What type of symptoms would they perhaps have from having low testosterone or estrogen?
Yeah. So with just testosterone, so let's just say they haven't hit menopause yet. They're going to be very similar to men. So they're going to have fatigue, lack of motivation, decreased libido. And that's probably the most common that we see or hear about. I mean, women will say that they're never interested, in sex, and we check their levels, and of course they have almost no testosterone. And then that's also important as we're discussing exercise, as I'm sure the importance of building and maintaining muscle. And so that's important for both men and women. And so if they're low on testosterone, they're going to have difficulty doing that. And so, many times we'll replace the testosterone, and then again, they have more energy. Now they have a sex drive that they haven't had in years. And so they're happy, husband's happy. So it's a good thing. And estrogen is completely, different. And again, that's going to become low once they hit menopause. And that's going to cause hot flashes, vaginal dryness, stuff like that.
Okay. And speaking of exercise, is this something that most of your clients are coming in and they're not really that active? What's like a good first step you would try to recommend for them as far as just, doing some exercise? Is it like a couple times a week? And if so, what type?
Yeah. So I probably see a skewed population because they're coming to me, most of them are insulin resistant, they're overweight, stuff like that. I mean, I'm not getting, we get some healthy people, but so really just trying to get them to move. I mean, that's usually where we start,
right? Is
just move, whether that's, getting 10,000 steps a day, just move. I mean, because if they're doing nothing, which many times that's the case where they're starting, and I say, you need to go do, CrossFit 3 or 4 times a week, or, go on a bike ride, go join a gym. It's not going to happen. And so first we we just try to get them moving. And then once we get them moving, we have a fancy body fat analysis in our office. And so we can put them on that shows the amount of body fat percentage they have, and as well as shows us lean muscle mass, and it breaks it down kind of segmentally.
Is that a DEXA scan?
We do not have a DEXA scan. No, we have an in-body scan. So yeah, DEXA is the gold standard, but I mean, super expensive. So. But I've liked it. I mean, it seems pretty accurate, but anyway, so it gives us a tool to start to say, hey, look, you're really low on muscle. Now that you're moving a little bit, let's focus on building some muscle and, kind of talk about how to do that. I mean, we're not trainers. So I don't, that's not necessarily what we do. So, I mean, we'll send them to the gym, get them hooked up with other people, but we, if nothing else, we stress the importance of it. Yeah.
And, I guess through all this, what would you say is the biggest downside to just our model of healthcare right now? And what would you recommend individuals doing, if they're just going to a primary care and that you're just being put on these, these drugs? What would you recommend, and what has to be changed?
Oh gosh. I think the whole system needs to be, just shut down and started over. It's terrible. Like I said, as we alluded to at the start, everything, and I discovered this later, everything is really ran by big pharma, and even come to find out, even like the medical journals that, I used to look at the studies and say, oh, it's quote evidence-based medicine. 2/3 of their income from these medical journals, like the New England Journal of Medicine and stuff. I mean, 2/3 of their income comes from big pharma. And so it's hard on people like me who are trying to really find out the true data. You just really have to spend some time and go digging for it. But anyway, so yeah, there's a lot of problems with healthcare. What I tell people is our current healthcare system cares nothing about your health. It's a big money-making machine. And so I think that's probably the first thing, the biggest thing to understand, because so many people say, well, but my doctor, said this, and they just don't question anything. And so, but if they understand that our healthcare system is not set up, it does not exist to make you healthy, it does not exist to make me healthy. So, once they understand that, then I would say take responsibility for your own health. I mean, you're in charge of you, you're in charge of your health. Now, all that being said, I have many friends that are still doing quote conventional medicine, and they're good people. So these doctors aren't bad people. They're doing what they think is right. It's just how they've been trained, and they can't see it any differently. Hopefully more will, just like what I did, where I kind of got the veil lifted from my eyes, then I can kind of see it for what it is now. But again, they're not bad people, and they mean well. So I would give advice to take responsibility for your own healthcare, do your own research, and find a doctor who is willing to listen to that. So if you find something online, I'll take vitamin D for example, and you go in to see your doctor and say, hey, I'd like to check my vitamin D level. I read some stuff about vitamin D. And if they say, no, I'm not doing that. That's, I've never seen any evidence on that or whatever. I mean,
right.
You might need to find another doctor. I mean, you need to find somebody who's going to listen to you, who's going to be at least somewhat willing to think outside the box. And if you find something that is contrary to what they think, then they should be open to that, and they should be open to, continually learning. And so if they're not, and they're closed-minded and think that they know it all, that's a big red flag.
Yeah, I agree. I think, if you, like you mentioned, if you have a primary care physician that's closed-minded in that sense, and if you bring information to them and they don't even want anything to do with it, then it's probably time to find someone else. because there's plenty of them out there. And I know there's more and more coming up that are a little bit more on the holistic end and focus on functional medicine. And hopefully this will be a trend that continues.
For sure.
A question I ask all my guests is, if you were going to give one tip to an individual, maybe in their 40s, 50s, and 60s, and they wanted to get their body back to what it once was, let's say 15, 20 years ago, what tip would you give that individual?
Well, with all I've just talked about, it's hard to narrow down to one.
I know it's a loaded question.
Yeah. So if I had to pick one, at least to start, I would probably say eat foods with one ingredient. And if I tell people all the time, if you do nothing else, and, because a lot of times I'll go over all this stuff that we've been talking about with them on their first visit or their second visit after we have some blood work, and you can just kind of see their eyes get big, and sometimes they're overwhelmed. And so, I'll say, if nothing else, you don't remember anything else I say, if you'll just eat foods with one ingredient, you're going to be healthier than most people. And so, I kind of talk about what that looks like. So, eggs, they have one ingredient, chicken, one ingredient, fish, beef, broccoli, and I will tell them, contrast that to a box of Cheerios. It's going to have, I don't know how many ingredients in a box of Cheerios, but it's,
a lot,
6, 7, 8, 9. So yeah, that would be probably where I would start, is eat foods with one ingredient.
Yeah. I remember I used to tell clients, eat things where you can pronounce and what's on the label.
Yeah.
In an ideal world, like you said, there is no label and there's one word. Perhaps that might be a stepping stone, right? First, find stuff that you can pronounce and that maybe is not over like 6 ingredients. Then if you can get to one ingredient, you're right. I mean, honestly, if you don't do anything else, if you don't see positive impact in your health, then there must be something else going on.
Yeah, for sure.
And do you do telemedicine?
We do. Yep.
Okay.
As of now, we keep it within the state of Oklahoma.
Okay.
Just because the laws here in Oklahoma are kind of gray. And as far as doing televisits outside of the state, as far as licensing and stuff like that is concerned. And so I think that's probably going to change as, telemedicine, is just becoming more and more common, especially when COVID hit and people,
right,
were just kind of forced into doing virtual visits. I think we're going to see that change. But as of now, I just do televisits within the state of Oklahoma.
Okay. And the best place for people to find you, is that on your Vibrant Life website?
Yep. Vibrant Life DC stands for direct care, vibrantlifedc.com. And I also have a website, a podcast, drgregdennis.com. So.
Okay. Yeah. You cut out for a second. Your name of your podcast is FitRx. Is that right?
Yes, sir. Yep. FitRx. Yep. I started that, I don't know, about a year and a half ago, just because of, my passion for health and wellness and longevity. And I found myself just constantly reading all these books about longevity. And so I thought, man, it'd be great to be able to talk to some of these people. And
right,
so I started this podcast. And so, it's been great to be able to, to talk to like-minded people like yourself and other people, all over the country about, just health and wellness and things. So I started that about a year and a half ago. So it's FitRx, FITRX, and it's on pretty much all the podcast platforms out there.
Okay. Yeah. We'll definitely put links in the show notes for that. And I think our episode is probably coming out maybe in the next few months, or give or take. So that'll be great. And awesome. And well, I appreciate you coming on. And it's great to see a family practitioner who is, teaching these methods and have changed over from conventional to more of a holistic, and finding the root cause of really what's causing the problem. So I give you a ton of credit for doing that. And hopefully that'll be a trend for other doctors to do that as well.
Yeah, no, appreciate it. And I hope so. And appreciate what you do. The more people we have out there, just trying to make, educate people and make people healthy, the more the better.
Yeah. Appreciate it so much, Greg. Thanks so much for coming on.
Yeah, my pleasure. Thanks for having me.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again and have a great day.